welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of Kevin MD. Today in the show, we have Thanh Tran. He is the CEO of Zoeticx, and he co-wrote the Kevin MD article, Will U.S. Healthcare Match Native Americans' Treatment of Chronic Kidney Disease? And he co-wrote that article with Donald Volz and Eric Tran. Thanh, welcome to the show.
Thank you very much. Thank you for having me.
So we'll get into your article in a little bit, but first off, can you share your story and journey to where you are today?
What attracted me in healthcare was, one of the first thing is Dr. Don Volz and two other medical advisors who pointed to the fact that there is a lot of preventive medical error in healthcare that leading to between 100 to 400,000, depends on the thing that you're looking at, preventive medical error that leading to death. And the first thing I look into healthcare is where are all the applications? Mm-hmm. Healthcare have a recording system in electronic health record, but then there is a whole set of collaboration, cost efficiency, communication, and all the preventive medical error is coming from miscommunication, dragging and dropping the thing between the cracks. So where are those applications? And then going back to my IT, I look at that and say, well, because you have so many different EHR systems, it's hard to build an application running on all these things. So my middleware infrastructure skill get in, we build the middleware infrastructure, we build the first application, which is on intensive care unit. But there is a need, but it's hard to justify the need at that time. In 2011, 2014 is all EHR that occupy all the CIO. So that is a little bit of a quick journey how you get there. And in 2014, 15, we leverage our platform to creating a set of solution and preventive care. And the reason that we go into preventive care, because I learned unless you have a revenue side equation in healthcare, you cannot get the attention of the executive to adopt that. And we leverage the chronic care management and the remote patient monitoring from CMS to create a better business model, not cost saving justification, but a revenue generation. On top of it, creating a value add for both the patient and the payees. So we are trying to create that business solution and then have the impact back in healthcare. So that is a little bit of a journey where we are.
Your background in IT, what were some of the unique challenges in healthcare that you had to learn along the way?
It's not totally different from the early days of IT. So I usually use this example. Back in the early days on the teller machine, right? Say you are a customer of Bank of America and you need $40 cash. You stand in front of an ATM machine from Wells Fargo. You can plug the thing in and then you can get the money out from your bank account in Bank of America, right? So you step back and think about it. Think about the bank teller machine as an application. You taking the money, but the database and the account is coming from two different things. So it doesn't matter what the front end application belong to. You should be able to access to the back end. So the one thing I find out is if you're using a certain system in a hospital, and then you have your primary care provider using Athena Health, good luck changing that, interchanging that, right? But in the end of the day, the truth is, frankly, your vital, your heart rate is a number. It should be shared. It just happened to be different, right? So now, this is the stage of healthcare where we talk about interoperability, but the interoperability part of the equation was like, it's not about sharing information. It's about ability to access information so that you can create solution to reduce the burden of doctor on interacting. So let's take another example. A patient has cancer, go to the hospital for chemotherapy. Your primary doctor need to access that information so that it collaborated and saying, the next time you do chemotherapy here, this is what the result I find. How is that collaboration? It's hard, isn't it? Right? But you need an application to create that collaboration. But that application needs to be able to access the information anywhere, anytime. But you cannot just do the IHE way because the information exchange requiring duplication of data. So you have a massive database centralized. So here's my background in IT help. And when I was with BEA, I happened to manage a business group named Data Service Platform. The CEO at that time is Mr. Alfred Chong. He has this motto of kung fu. Data for him is like water, and water is very powerful in the kung fu movement because it's fluid. So the data service platform or information as service is pretty simple. It's saying instead of duplicate the data, you have access point to get the data where it belongs. So the truth of the data stay in the database, but then the application be able to extract the information when it's needed and rely back on the back end to do that. So in healthcare, you have the EHR is already HIPAA compliance protection of data and other things. Why do you have to replicate the data into the HIE to go through the headache to service the application? It's not very convenient to find that thing too. But if you have an application with a platform, be able to have an engine to point it where Thanh Tran record is. It's just like a direct queue service, isn't it? And then be able to extract the data. And when you're done with the session, the data go back to the source. And that's the dream of everything that we're doing.
All right. So let's talk about that Kevin MD article you wrote with Donald Volz and Eric Tran. It's titled, Will U.S. Healthcare Match Native Americans' Treatment of Chronic Kidney Disease? Now, for those who didn't get a chance to read our article, can you just walk my audience through it and share the story of why you decided to write it?
We have solution in chronic care management, but when we do start the research to implement the solution, me and Dr. Don Valls and Eric Tran developing a kind of a map. They called it the chronic care disease interrelationship. So what it means by that is this. And I quote Dr. Don Valls' comment on this. He's saying, in medicine, we all know this, but nobody put that on paper. And put in paper in this way. If you have a blood disease kind of related, you have hypertension and diabetes. But then when you have blood release things, then you're forcing your kidney to work overtime. So eventually, there is a relationship when you have hypertension and diabetes to lead into kidney disease. Okay. The one thing about kidney disease also is if you don't test it early, you don't even have the symptom. But when you have the symptom, guess what? It's stage 4, and you need dialysis, which is your quality of life is going to be dropping like a rock. And our solution in preventive care, both in remote patient monitoring and chronic care management, what we are focused on is the early detection of something that happened. If you have a diabetes, we know that diabetes can have show a symptom that may you developing into other chronic condition. And then if you monitor on a monthly basis, if you look into the physiology monitoring on a monthly basis, on a weekly basis, you can early notify and say, hey, this person may have some other condition, let's test him. Okay. What we're doing is a little bit different than the article in the with the Indian health system. Indian health system has done this one, which is very good. If you have diabetes, I'm going to test you for kidney disease every month. Okay. The whole idea is to test it every month so that they can detecting early indication of kidney so that they can treat it and slow down the progression towards stage 4, right? And that saves them money. It saves life too, save better quality of life. But the difference in the Indian health system approach and our approach is we're saying, that's right, but if you test it every month, it will cost a lot too, right? So why don't we leveraging the chronic care management and remote patient monitoring from CMS and then put them on having remote nurse and remote monitoring via devices like this so that you can collect the data and monitor it and then intervene when it's necessary. So it improving the burden on the patient, the burden on healthcare system, and it's improving the cost efficiency. And that's the whole idea about the article. And we're using the article to point out one thing. There's proof point that if you intervene early on detection of chronic kidney disease, then you're improving the number of patients. You reduce the number of patients having kidney over the years, and that's what the whole thing about.
We're talking to Thanh Tran. He is the CEO of Zoeticx, and he co-wrote the Kevin MD article, Will U.S. Healthcare Match Native Americans' Treatment of Chronic Kidney Disease? Thanh, so what are some of the barriers and obstacles that's preventing you from realizing the vision that you just articulated?
Sounds funny, but it's about old people. I always anticipate, I can say I'm a 62, so I can save myself too, but the issue is this. I always anticipate some issue of rolling out such solution to the population, elder population, right?
Mm-hmm.
So here, this is a couple of things I want to highlight with you. Take an example of the remote physiology monitoring, right? There's a lot of solution out there.
Mm-hmm.
But one of the things that I saying is they fail to understand this. If you burden the patient on reporting the data by pulling the iPad and entering the data, then you fail to roll out to the population, because old people, most of them doesn't do that every day. And sometimes you need to do it 4 times a day. How are you going to do that? It's called patient burden.
Mm-hmm.
You have to come up with something that reducing that burden to the minimum, right? So you have to have an ability to collect that data without them doing anything. So here's an example. What our solution is, you wear the device. The device is pluggable. You can plug a device like this, or you can have a scale or anything, and then suck up the data remotely via your phone application to the center. And that's one way to do it. That's one. But I tell you, recently I run into cases in a doctor office in Arizona. To register elders to a program like that, it's required a lot of effort from the doctor. Doctor need to talk to the patient. Patient need to be comfortable for that services, to put in chronic care management. So in the beginning, we didn't think about that as an issue, because we are focused on solving the back end, the patient burden and everything, and the thing to make it easy. But we find out that, first of all, doctor have to call in the patient to offer them that service. So it's one burden. You have to find which patient has 2 chronic conditions to qualify to get that. Even we scan the database, we tell them here's a list of patients that qualify, but you have to call them in and all these things. The logistic of all people to come into the office to sign up for that is also a burden. And that burden is really slowing down the registration of such such services. What we're doing lately is creating a concept for I call it the integrated care and preventive care platform. And what it means is this: if you look at the population of elder, where are they really living, right? So they have a set of people who go in nursing home. They have a home assisting living. There is senior community, and then a number of them stay at home, right? So if you think about it, what we are working with other partner is saying, there's a partner who providing mobile care van, right? There's a partner who willing to do is hiring nurse practitioner and nurse to staff that. So if you step back and think about what we are trying to do is to say, hey, what if I have a mobile care van who will park at your door, who will offer the primary care right there, will be helping service the community, right? And then we'll focus on preventive care so that it improve the quality and everything. It will improve the medical access to the seniors and things. And then we're going to be at your doorstep. So you don't have to really call a cab to go to the doctor to sign up and everything. But what we are going to be is that we at your door. We are create a convenience for you. And then also what we're doing is also when we monitor if something going wrong, we are at your door to help you doing the next step. And that it is for me something that is going to be innovative and revolutionary in healthcare. Now, especially during the COVID time, you combine telehealth, mobile, and preventive care, and remote monitoring. All these things will be something that I would see would change as part of the post-COVID. And this is one of the things that we're working on too.
Sure. And my final question is
Mhm.
a short take-home message for the Kevin MD audience.
Healthcare right now is, from my point of view, still silo, right? The medical side doesn't talk to the behavioral health side, but they are interact, right? Depression is a chronic condition. Depression leading to hypertension and diabetes. So that is interconnection is missing. That's number one. Number two, just I touched about the mobile and telehealth. You need to interconnect that thing to offer an effective solution. And it is a time to do that. It is a time that healthcare need to be moving beyond the recording capability offered by EHR system. We're not just talking about interoperability. We need to talk about solution designed to effectively address this and helping care provider focus on their profession instead of worry about everything. And that's my simple message.
Tan, thank you so much for sharing your time and insight. And thanks again
Thank you.
for being on the show.